Hello all, my name is Dr. Ante Weathers, and I have my doctorate degree in embryology from Texas Women's University. I have studied various health-related concerns to the embryo, fetus, and uterus for over 10 years now. I am pleased to be invited to speak at the Dallas Baylor Hospital today and give my disorientation over Down syndrome, also called trisomy 21. Down syndrome cases can be seen in out of one of every 1,100 babies born into the United States. In each cell of the human body, there are 23 pairs of chromosomes. Down syndrome occurs when a baby actually has an extra copy of chromosome 21 in their cells. Children with Down syndrome will grow and develop like any other child but miss key milestones like crawling, walking, talking, and may take a little longer than normal babies. You can help your child develop through physiotherapy to help and gain the muscle tone again needed to crawl, walk, and also actually help them out by putting them in therapy such as occupational, speech, and a little bit of psychology therapy as well. In my offices, we are under the care of Baby N currently. Baby N is a Caucasian 3-month-old male baby from a low-income family whose only medical concern that he has at the moment is Down syndrome. The mother was unable to have proper prenatal care during her pregnancy and while the fetus was in the mother's womb in the stomach. The mother of Baby N actually suffered from urinary bladder infection during her first trimester of the pregnancy. At this time, our team at my local office decided to go and do special screening tests to determine if there were any issues as well as other problematic issues that may arrive in the baby. The team of doctors and reproductive specialists were able to find an abnormality actually with the baby. This was from an ultrasound scan done at 13 weeks into the pregnancy, and we were able to measure the thickness of the fluid behind the baby's neck called the nuchal translucency. We found it to be larger than normal, and that does actually help us determine that the baby was going to be developing some type of Down syndrome because the amount of fluid behind the neck was much larger than a normal baby's would at this term into the pregnancy. Currently, there is no specific treatment for Down syndrome, but there are several important treatments for the complications of the condition. You should have your child routinely screened to help ensure that he or she will get appropriate treatment and also be able to fully develop and grow as accordingly and more parallel to a normal child that they can. Your baby will need to see some well-needed checkups and immunizations as all babies will need. Having Down syndrome does mean that your baby may have some extra health issues and need more checkups and more regular doctor visits to stay healthy, but rest assured that should not be a red flag for you to not want to be treating the child that has Down syndrome as a normal baby or any of your other normal kids in your family. They should have their hearts and hearing checked on the regular to see if there are any signs of heart, cardiovascular problems, and or hearing problems. The head, eyes, ears, nose, and throat, hence for short, are going to be main areas that health professionals need to go ahead and check on a daily basis. As health professionals, we are the main line of defense when it comes to diagnosing these issues and concerns and stopping difficulties with these patients as well, whether it be infant with Down syndrome or infant without Down syndrome. More research and studies are still occurring to find more formal treatment, more prevention options, and also earlier testings besides the normal ultrasound screening and blood tests and the amniotic fluid to help us be able to occur and catch the cases of Down syndrome in a much earlier convenience. I encourage everyone and you all to volunteer your time and knowledge into getting into this field and helping out with the health concerns of Down syndrome. Thank you so much.